Good afternoon. I'm Scott. I work at Spring Hill Medical Center. I am the clinical education coordinator for Spring Hill. I am an RN, registered nurse. I typically coordinate new hire orientation. So what we do is coordinate some of the initial as well as the ongoing training for nurses. So they're already nurses, they hire on with us. We start with them. I'm probably one of the first people other than the manager hiring the nurse to meet the nurse and spend some time with them. We do a pre-hire assessment. So even prior to them being hired at Spring Hill, we do an assessment and test with them to kind of assess their competency levels and with nursing interventions, functions, safety, and those types of things. We also coordinate their orientation, which lasts about a full week every month. So every month I'm training new nurses as well as nursing staff. So the certified nurse assistants, the unit secretaries, the monitor technicians, we coordinate all of that and train them, instruct them, follow up with them, get them onboarded to their respective units, follow up with their progress, and then throughout the rest of the month or the year, I am teaching, coordinating and teaching certification courses for the nurses that have to do annual certifications or biannual certifications, whether it's advanced life support, basic life support, pediatric life support, EKG rhythm identification, which is something we're actually teaching today, to establish their competency, validate their competency in areas where they have to function as a nurse and they have to prove that they can perform and competently, safely to take care of their patients. And we also coordinate their annual competency validations, so that involves several different types of nursing interventions that they have to constantly kind of validate that they're competent at doing. So we coordinate those with the units. I do a lot of collaboration with the different unit managers, the nurse managers, as well as the staff. I work a Monday through Friday schedule typically. I get here around 7:30 a.m. and I'm leaving around 4:30, 5 o'clock p.m. Stress level, as I teach the nurses, each unit has kind of a typical stress level. Mine, because I enjoy what I'm doing, I like coming to work every day, that plays into decreasing my stress level. I do have stressful periods where you typically have deadlines for competency certifications, for hires, or anything like that. It will kind of increase my level a little bit. As far as your education is concerned, I would recommend that you, of course, if you're in a 2-year program, complete that, get into your nursing. I would suggest at that point doing an RN to BSN program because more and more that's becoming the baseline standard 4-hour profession kind of nationwide. There are targets now that hospitals have a certain percentage of their nurses as bachelor's prepared. So get your bachelor's while you're working, and get all the clinical experience you can. My background, I do recommend acute care, has just a lot of thinking involved. Organizational for ER and med surg, any of the units are great wherever you perform well. And then plan to go on and get your master's, do a BSN MSN program in education. Mine is a dual education administration that I'm currently working on. So that's what I would recommend there. present yourself even as you begin. If you're ADN, if you're BSN, present yourself to the education opportunities on your unit, and you will get noticed in the education area. It's always going to be here. We're always going to need nurses to be educated. And if you're the one wanting to do presentations and posters and work on stuff to improve your unit, you're going to be the one who people like me are going to notice and say, hey, I want them on my team. The best part of my job is the rewarding part when I see new nurses grasp what I'm trying to get through to them, to train them. When I see them accomplish and develop professionally themselves, that's what's rewarding to me. I had something to do with that. I think it's that I enjoy nursing, the profession, and that was kind of the basis, and I enjoy teaching. I have to teach one-on-one, I have to teach small groups, I have to teach large groups, I have to communicate with care techs, secretaries, nurses, physicians, administration, whether I'm in what type of meeting I'm in. If you're not comfortable communicating, that might be a challenge. That might be some kind of the worst part about this job. One of the best parts about the job is I don't have to worry about what to wear every day. I get to wear scrubs. How about that? One other important thing you need to be ready for in preparation for this type of job is this is staff development. This is what we do. So on the flip side, I have to be the lifelong learner. I have to stay up. I have to stay ahead. If I'm going to train them on anything, I have to be trained myself. So professional development is huge. There's the nurse that becomes a nurse, clocks in, clocks out every day, and it doesn't ever go beyond that. But then there's the nurse who constantly is developing themselves professionally, and whether it's learning, whether it's school, it doesn't have to be formal education for the rest of your life, but it's going to be journals, it's going to be reading, it's going to be seeing what the latest evidence-based practice is, it's going to be seeing benchmarking and seeing what other hospitals are doing, how we can do things better. It's constantly it's a drive to improve the quality, improve the safety, improve the processes for our patients. It's a constant learning, so that might be something that you might not be willing to do that would be required for this job. Okay, some good advice. Work hard, study hard, do well at what you're doing right now, because it will always be with you. So, whatever you're doing, work hard at it, do well at it. Nursing, very competitive. So, and it's something you need to be sure that you want to do. I actually went to college with some nursing students, and we got through a couple years, started into clinicals, and all of a sudden they discovered, well, this is not what I want to do at all. And so they bailed out. Well, by that time you got a lot of money, a lot of time, a lot of effort, and it's blown, it's wasted. So kind of find out early. One way to do that, especially with what I see, we hire CNAs, care techs we call them. Take you a 2-week, 4-week program, CNA program. We're always looking for college students, so it's typically not difficult to get the job. It puts you right into the field, and it's going to let you know pretty quickly, this is for me or this is not for me. Nursing is something that you have to have the heart to do, because what we do for people on a daily basis, if you don't have the heart for it, you're not going to do it. You're not going to do it for a paycheck. You have to have the heart of a nurse to be able to do well as a nurse.